Good morning and welcome, everyone. We'll be getting started in just a second as we're letting folks enter into the space. We will have a short 1 hour time together. And so we want to make sure that we are mindful of your time and, I don't know, really have a good space together. And so, all right, I think most folks are in. All right, we can get started. Bonjour and welcome. Thank you for joining us for the second of our Sexual Assault Awareness Month webinars. The first one focused on what we meant by the response and what that really looks like in our Indigenous communities and in our tribal spaces. And so today we're going to dive a little bit deeper into how can we practically use our Indigenous values to really help us shape that response to sexual violence. And so we're going to talk some about the theory and hopefully also give some ideas about how you can, within your work, be it as an advocate, as a community member, or part of a systems professional, best do this. And so as you likely know, we are with the Minnesota Indian Women's Sexual Assault Coalition, and this training is part of our National Tribal Sexual Assault Resource Center. And so today, we're going to be talking, as I said, about what do we mean by Indigenous values, those strategies for both the systems and for the community response to sexual violence, some considerations about how to make that practical and where some of the rubs may be, as well as, through the chat, we really do hope that we'll be able to hear a little bit from you. And so my name is Jolene Engelking. I am Eagle Clan, and my family is from White Earth Nation. I am a mother. I am a community-based advocate at heart. I am a licensed social worker. I am somebody who, I don't know, loves theater, loves running, just loves bringing my full self to all the spaces that we can be in, which I think also aligns with what we're talking about today. And today, in addition to our wonderful team of ASL interpreters, I have my colleague Ingrid with. Would you introduce yourself?
Hello, my name is Ingrid Anderson. I am the National Policy Director for the Minnesota Indian Women's Sexual Assault Coalition. It's an honor to be with you all here today and to be talking about our response to sexual violence. I come to MIWSAC with a background in advocacy, both in child advocacy centers and in serving as the Director of Victim Witness Assistance in a prosecutor's office. I hold my MPA, and I'm honored to use both my education and my experience in serving communities to talk to you about how to integrate our values, our traditional Indigenous values, in the work that we do every day.
And if there are any issues technology-wise, please chat into the panelists. And we do have someone working tirelessly in the background to help make sure that everything goes smoothly for folks. All right. And so today, we're going to just be sharing this space together. And I want to name that both for those folks who are on now with us live, as well as folks who are going to be listening to this recording in the future, that we always want to make sure that, in the midst of all of our work, we are trying to sometimes take a little bit of space and to just be present with each other. And it is so hard, even within meetings or even when I'm doing training, sometimes I'm like, why am I texting as I'm presenting? And so I just want to name that we really want to work to shift that and to be able to really be together and acknowledge that even though what we're talking about is incredibly hard sometimes, it's also very real, and survivors and our communities and our families need us to be having these conversations, to be breaking down some of this, to break that silence that has existed for so long. And these conversations get a little bit messy sometimes, and we may not have all the perfect words because we are human. And as we talk, sometimes I recognize, I was telling Ingrid earlier that I can give this presentation, 5 times, and it might come out 5 different ways, because I think those who are, I don't know, what's meant to come out is meant to come out. And so we hope that folks are able to share in the chat both their thoughts, their ideas, their questions. And for those listening afterwards, please always feel free to reach out and continue this connection. So All right, a little bit more about what we're going to do today. And so we're going to talk about how we respond to sexual violence. We dove a lot deeper into that in the first one, but it's still going to be really relevant to today. We're going to think about those needs of survivors and how, when we are using our Indigenous values, that we still always need to be centering and bringing survivors in and having them really help shape the response. And that's both those survivors who are coming to us, right after something was done to them, as well as the survivors that exist in all of our families, all of our communities, and many of us. We're going to explore some of those ways to use those values and culture to improve the community response, not just the systems. We also want to be talking a lot about the full community response to sexual violence, and think a little bit about the future. All right. So just kind of for groundwork, and so I've already alluded to this, we are talking about that full spectrum of sexual violence today. We're talking about those things that are happening, right now within our communities, where so many of you, if it's the typical layout of our trainings, tend to be about 80 to 85% advocacy. And so these are the people that you're often going to be seeing coming through your doors, or that you'll be interacting with and connecting with and building a relationship with. But also we need to be thinking about those folks who have experienced sexual violence all across the lifespan, and thinking about how so many in our communities have experienced, sexual abuse as a child, as well as how that then impacted, those early sexual experiences as an adult, consensual, non-consensual, and how that may be impacting them as we're raising our children, as we are kind of navigating life and going to work, doing our everyday things, and thinking about how sexual violence has that impact on us as individuals, in that whole medicine wheel, especially, and that's going to vary depending on each and every person in so many different ways, but also recognizing that ripple effect that the violence has had on our families, our friends, those close to us, but also as Indigenous people. Part of this is that at our roots, we are collective people. Our community is center to who we have to be. And while there's many families who've had to kind of, separate off for their own safety, we're also having to have us think about, like, not just, that one survivor that we're working with at a time, but really thinking about how are we best, changing our systems, our communities, the way that we work, the way that we think about the work, to best, impact the whole. Anything to add on that, Ingrid?
I'm just so grateful that you shared that perspective. I hope that we can hold this through our conversation today, to remember that it's not just the many ways that it affects us, but the many different ways that sexual violence and the trauma from it affects every part of our community, and the way that we connect both as individuals and community to community. And you might have a light bulb moment. You might have something come to mind as we're talking today, like, oh, that happened, or we started doing things that way, or I started structuring my relationships or my work in this way as a response to the trauma that I experienced or that I witnessed. And as Jolene mentioned at the start of our conversation, we want to hear about those experiences. We want to hold those with you, and to learn from them alongside you.
And I think, to really begin this conversation, I'm just going to acknowledge I was unmuted, which after doing virtual trainings for, 6 years, you'd think that would never happen, but we are all human. But I felt when we're talking about this, this webinar series really came up in relationship to one of our federal funders, and thinking about how are we best able to help people think expansively about the work that we're doing, and how even within folks who are working, directly within, tribal nations, sometimes it can be incredibly hard to pull away from a very linear, very small scope of what we mean by response. And so I started to think about, okay, this is a kind of a presentation that we've done in many sorts of ways, particularly thinking about how are we best, within our programs and within ourselves, how are we living this out? But we've been working more and more on trying to expand it to how is our response really, can that be shaped? And is that harder? Perhaps sometimes, but what could the impact really be? And so when we're talking about Indigenous values, I think that people, especially folks who, are non-native, sometimes have a very, I don't want to say small view, or, like a very different view of what we really talk about when we're saying Indigenous values. And sometimes we mean things that are very specific. Like later in today's presentation, I will show some of the, like the values and the teachings of, like my community. And so sometimes those are like set things, right? But we're also talking about those things that are sometimes harder to name, those things that are harder to pinpoint, that often kind of might fall under those terms of like, like cultural responsiveness or culturally appropriate care or all these sorts of things. But it's really recognizing like what makes our tribal communities unique. And we're talking both about, tribal sovereign nations, but also those of us who, we've never lived on tribal. I've never lived on my home reservation, right? And we're recognizing that 80 to 90% of folks do not always live on tribal land, and especially for that, it can be a lot harder to be living out these values or to even be able to recognize. But there's things that we know. There's things that we know, how when we're at a conference, somehow all of the Native women and Native people, we find each other, right? There's something that just draws us to each other. There's ways of there's ways of talking and communicating that is even sometimes hard to tell to outsiders or to people who aren't Native. We recently hosted our sex trafficking conference in San Francisco, and it was this beautiful moment of feeling a space of breath where you didn't have to always be explaining things or explaining the framework or where you're coming from, because people just innately knew. And so we were able to get to the work, right? And we're able to have those deep conversations without having to be like, oh, we need to take all these steps back and like talk about the historical trauma, talk about the different protocols different communities have and all these sorts of things. And I think that so often when we're thinking about because like we've even done trainings, we're developing resources on how to help like non-native programs better work with tribes and work with Native survivors, and that is so important. And it will never fully encapsulate like what do we mean by being culturally responsive. And so that's why it's really fun right now to be thinking about how communities, especially as more and more funding is going directly towards sexual violence and sexual assault specific services, can we from the onset build and develop our programs in ways that are, not to co-opt another movement's phrase, but for us, by us, right? Things that we are truly doing that is making sense within our communities and making sense for the way that sexual violence presents and what will resonate and what will help our communities. And that may not be the same for all spaces, because some people have been doing, sexual assault advocacy for years and years. And now we're asking people to kind of take that pause and really relook at and perhaps, redesign or redevelop or reconceptualize the way that we do our work, right? That was my little soapbox. For those of you who've been on our webinars before, I just kind of do that sometimes. So Ingrid, what do you think? What do we mean by Indigenous values?
I appreciate the way that you articulate sometimes the intangible or indescribable ways of being that we, depending on how we were raised or how we were taught, we've absorbed from our mothers, from our grandmothers, from our elders. And we're teaching those in the ways that we are in community and in the way that, we raise our children, the way that we do our work. And so I do want to invite people today as well to pause and to maybe introspect a little, to think about why you do your work the way that you do, and what values, traditional or maybe unique to your family that is connected to. I am always in awe of the resilience of Native women in particular. I shouldn't say resilience, but really the strength of Native women to adapt and to stay connected to those core values that we've been taught. We know that there's safety, there's community, there's connection in those Indigenous values. And when we can see them clearly, when we can identify them, we also can see when they're being used against us or when they're being twisted or co-opted, maybe by abusers or by agents of the system to maybe make us feel less than or unworthy of being in certain spaces. And so I'm not sure what community everybody on the webinar is from, but as you think about that, we really want to hear from you. What do these values look like in action for you? And if you've had the experience of them being used against you or making you feel like you or somebody or something has made you feel like you can't live those values out in your work, we definitely want to be in communication with you about that, to learn from, to heal from, and then to equip all of us to truly live those out. Like Jolene, my family is we lived in Minnesota, but my family's from South Dakota, and the values that were taught to me definitely came from a lens of, having survived boarding schools, having survived, violence, racism, all of these things, poverty, intergenerational trauma. And it's been a joy and it's been a lot of work, exhausting at times, to untangle those traditional values from the lens of trauma. And so we hope that we can talk about that a little bit today with you all.
Also, before we move on to this next portion, I did want to name a couple of things about culturally relevant, culturally competent, culturally specific. There's a lot of different terms that have been coined over the last probably, 8 to 10 years that all have slightly different nuance and slightly different ways that, it helps people conceptualize things, right? It's ways that people be like, oh, people want to do good work. But I've also, it's happened more than once, where people have been like, oh yeah, I attended a half-day training on like historical trauma in Native communities. And that means that I know the culture and I can do this work, right? And it's so hard because it's like we were talking earlier about how even those of us who are Native, sometimes we don't know, like, we can't know everything. And especially doing this national work, like there's no way that we can truly understand the nuances of each community, as well as the different protocols, languages, little like unique things that make each community beautiful and sometimes really complicated to be in. And so we can't tell you exactly, what values to be inserting within your space or how specifically sometimes you can do that. But we're going to talk about some strategies, some ideas through the lens that we know, and that's what we're best able to do. And so kind of for the second question that's on here, the how are we responding now? Once again, we delved a lot deeper into this in that first webinar. But we're going to be throughout this, we're going to be talking a lot about the systems response, because that is primarily what we have right now. That is the system that we have in place. We have advocacy, we have, law enforcement, both tribal, federal, state, county, all of those sorts of things. These different ways that people can go to and seek. But also we're thinking about how when your friend comes to you and talks to you about something that happened to them when they were, 13 years old, how are you going to respond to that? If you are a parent or an auntie or an uncle and you're hearing, I have a middle schooler, and you're hearing some of those middle school conversations and thinking about how can we best have these conversations? Like that is a response, right? And so we're thinking big and small, but naming that a lot of this will be kind of systems heavy because that's what we have. And as much as there is ongoing conversations about, shifting or really changing or creating alternative pathways to justice, we're having to be pretty honest about what we have in place at this time. And so, while I've never been a fan of the idea of like small change or incremental change is still positive, because sometimes I want to do the big change. We have to embrace anything that we can. And so that's just a little bit of the mindset that we'll be going forward with. And so this was shared on the first PowerPoint as well. And so this is really talking about, well, when somebody has been sexually assaulted, who is part of that network of support? And when we're thinking about for today, like how can each of these, even within, the different ways that we have been, that our positions or disciplines have been created, or where we're really, held accountable to, what the frameworks are that we operate under, that we're all part of who survivors go to after sexual assault, or who people may encounter. And so when we're thinking specifically about like sexual assault response teams, often it is those advocacy programs, both community and tribal programs, law enforcement at the different levels, depending on what the jurisdictional authority is, prosecution in the same sort of way, medical, if there is a standing medical component. I know that many communities are not able to sustain, a strong medical forensic exam program, but some are. And that is an integral part to both take care of the person's full body, as well as in terms of the evidence collection, what that plays into the response. And corrections and or probation are also part of who should be kind of part of this group, even though we know that, often our Native men in particular have been incarcerated at incredibly high rates. At this point, the carceral system is one of the ways that people are able to seek justice from sexual violence. And so while very few cases get to that point where somebody is, involved in corrections or probation, how are they best able to really be supporting? And also thinking about the fact that some of these people who are not necessarily the perpetrators in these cases, but who are part of corrections and probation, have also experienced sexual violence throughout their lifespan. And how can we really be helping people in those disciplines really have a more trauma-informed and culturally appropriate or culturally relevant lens, which once again, those are buzzwords, and we'll talk a little bit more about what we mean. But how can we all be really thinking better and more holistically about what we're doing? But also we always need to be thinking about those key points of disclosure. And so that's going to look different depending on your community. There's big communities, small communities, however you define that. But schools and educators everywhere from preschools and elementary schools all the way up to colleges, right? And thinking about how each of those people are often hearing sometimes at first points of disclosure, or kids aren't even realize that they are saying things or that I don't even understand what's happening. And so how are we helping them be a part of the system? Thinking about mental health. And with the dearth of Indigenous mental health providers across our country, and how few folks go into clinical work. How are we best able to equip those mental health providers in our communities to truly understand both about sexual assault and what particularly sexual assault against us as Indigenous people means and looks like, and how to bring them into that response. Our traditional healers are so important. That early access to ceremony can be one of those things that is, most healing and most impactful for some folks. I've been talking to some people who are at, community child advocacy centers, their family advocacy centers, and how some of them, after every single exam, they offer, a cedar bath, which for our communities is one of those cleansing ways. And how they're able to do that right from the onset and have it incorporated throughout everything that they do. And we also have to acknowledge that traditional healers and some of our spiritual leaders have caused an immense amount of harm, and how some people have had harm done to them by those spiritual healers, but also for some folks, because of factors in life, may not feel welcome in ceremony, or may not feel welcome in these sorts of spaces. And how are we best able to, as a community, increase that side of the response? Our culturally specific programs. And so that is both, our tribal specific programs, ones who are often, in our tribal communities, housed under, be it behavioral health, mental health, within law enforcement, or wherever they're kind of, held. But also in in like urban areas, we have so many different culture specific programs, and often they aren't fully incorporated into the response in the community. And that's one of the things that we've been working tirelessly to try to help increase the efficacy and community standing of these culturally specific programs, as well as those other people, including those community members, just us, just who we are in space, the families that envelop people, all these sorts of things. And we have to always be thinking, and there's probably so many more, particularly depending on your communities. There's people who people go to, or there's people who hear things. Some communities, it's the barber. Some people, it's like the dentist, where people always go and they talk, even though there's hands in their mouth, or wherever it may be. But really thinking about how everybody is part of that response. And because of that, we also have to be thinking about, are all of these places really living out the Indigenous values that we want, or that guide in our communities? And that's not, I mean, I can't always say that every step that I do, everything I do is not fully grounded in values and not fully grounded in like the teachings of our elders and things like that, because I'm human and I try, and each of us are trying on a day-to-day basis. It's really difficult sometimes to be living out these values, and particularly when we are part of sometimes systems that, you know, make us do certain things or act in certain ways, or when we're saying no when our heart wants us to be able to say yes. It can be really difficult. So, Ingrid, I don't know how you're going to follow that, but
To your point, Jolene, about identifying community members and family members, non-professionals, people maybe who aren't acting in their professional capacity, as points of disclosure, or people to whom the community turns. I think and I hope, I should say, I pray that we all have someone, whether it's a family member, someone we're close to, who we can share our experiences with, and maybe who we do trust to help us access services or access the support that we need. In my time in direct service, I felt very well trained. I felt very well equipped to provide robust advocacy services, and yet I was getting a lot of feedback from my fellow multidisciplinary team members, including, you know, child protection, the prosecutor, law enforcement, things like that. You know, that victims, survivors, witnesses were non-compliant, which we do not appreciate that word, but, you know, they were missing meetings or not answering phone calls. And I am so grateful that I had an experience where I learned, and then from that point implemented a practice of warmly inviting people I needed to meet with, for, you know, to fulfill my professional duties, to bring anyone they wanted along to the meeting. If they wanted to bring a sister, you know, a sibling, an auntie, a traditional healer, a minister, anybody they wanted to bring along. Sometimes it was even they wanted to bring their probation officer, or they, you know, wanted to bring a sponsor. And once I started saying that, even though up until that point I had just assumed that folks would just bring their support system with them, I found that my meetings just got bigger and bigger. And sometimes folks would show up with like 5 or 6 support people, and our meetings became so mutually beneficial and really turned into a space for healing. I was so humbled to realize that even though I felt like I, you know, was participating in the systems-based response in a way that reflected my traditional values of family, community, kinship, the kind of wraparound support, not just from a systems-based perspective, that I had not articulated that. And because I had not used the words to specifically and warmly invite folks into that space, I had become just another member of the systems-based response. And I am so grateful for what I learned from that experience, that sometimes we have to just say it. Sometimes we have to share the expectation or share the invitation or articulate the value in order to make it clear to those that we serve, those we work with, that this is where we're coming from. And I started to get other members of the multidisciplinary team asking me, like, hey, can you help me get all of these family members here? Or during the height of the pandemic, when we were doing most of our meetings either virtually or over the phone, we said, hey, we need to get a whole new phone system installed so that we can have like up to 10 people on a phone call at a time, so that the person we're meeting with has everyone that they need in that space with us. And then they have that more longitudinal, more holistic support, really that we couldn't provide on our own. So there's a lot of room for opportunity, a lot of room for growth in what it looks like to articulate and to manifest those values, even in a systems-based response.
And so, yeah, and I think it's always just important, as Ingrid was just talking about, to do that naming. That's one of the things that I always try to start, even like with like, I name my own biases, right? There are those things that, I mean, it's not always the best habit, but I know the lens that I come from. Like I started this with naming, you know, that I come from a community-based advocacy background, which is going to shape the way that I enter into this work, right? You know, one thing I didn't say is that, you know, I spent what, 4 or 5 years participating on and also providing technical assistance to sexual assault response teams. And so that collaborative response is something that I deeply love, cherish, and critique all at the same time. I'm also, you know, I was trained as a social worker, which also shapes my lens, right? And so I also think that when it comes down to it, we need to be naming our values and those things that guide us. One of the things that our organization did even prior to me joining, and that we've kept building and adjusting, is we have literally like our values that guide us. Those agreements that we have, and those things that we have committed to as an organization that we try to reflect back on quite often, but at the same point, we don't do it all the time. And I notice it that when I'm starting to as a human, starting to feel afraid or starting to feel like tensions within the workplace, that if I turn back to those, it can help me either remind myself of how I'm supposed to be acting and what I've committed to, or it can be like, okay, so this is what I'm going to bring, and this is how we're going to help me move forward through this, right? And it sounds hokey sometimes, and I know this, but the more that we can lean on that, which is why when working with, you know, sexual assault response teams, one of my biggest thing is both like, if yes, create your vision and go back to it, create your mission and go back to it, but also always have those shared values and shared guidelines that we're able to really hold and adhere to. And some of those, I mean, some folks aren't going to be working in tribal communities, and so they're not, and they also don't necessarily have to be like, you know, those traditional values in that sort of way, but they're those things that we can commit to in space, that will really be helping us put aside ourselves, or help us be our best selves in order to do the job that we're there to do. Because we're in this work not for us, we're in this for survivors, for community, for creating change, both on the direct level, that micro level with an individual, but even more so creating changes within our world so that we aren't having to keep, you know, slightly tweaking the way that we do our response. And so I do hope, I mean, this is one of the things that like a lot of programs do, you know, I'm on a regulatory board, and part of what we do all the time is every meeting, you know, we started out with reading our mission, which really helps you understand that even though like we as humans have our biases and we as humans have our thoughts and our frameworks and things like that, that doesn't really matter in all these spaces, that what really matters is why we're there, that it is less about my own thoughts and my own beliefs and what a Jolene run world would look like. And it's really more so about how are we best able to come into this space to meet the needs of survivors, pushing aside those decades of drama and trauma that have happened between some programs, and really just doing the work in ways that is intentional, and that is truly true to our values. And what we keep seeing is that, you know, even, you know, tribal programs, often it's so difficult to live out these values, you know, several, I had like a family member who, like worked in a tribal government before. And in watching it, you would not see that there's anything that was actually like native or tribal about that, about the way that they talked to each other, talked about each other, talked about the community, the ways that their work was designed, the way that they're micromanaged, right? None of these things really live out, I think, how we want to be in space. And not saying that, living out Indigenous values means like things are willy-nilly. But it is guided by a sense of purpose and a sense of connection. And that if we really took time to reflect on each of these things when we're creating our policies, when we're creating our attendance policies, when we're creating our travel policies, when we're really thinking about how are we best supporting each other, there's so much we can do internally within each program, as well as then thinking about how does that then reflect externally when we are responding to survivors and working with partners who community needs us to work with, right? I lost my mouse. There we go. And so one of these things is, when we're thinking about our different roles, one of my big kicks for probably the last like 3-4 years has really been on thinking about how we all need to do better with recognizing what other people bring to the table, how we're recognizing that innate goodness and the curiosity, and how even though we may love what we're doing, that doesn't mean that our job or our role is the most important, right? We need everybody in a community to make it thrive and be successful, just like we need everybody in our community and who could be those key points of disclosure or those access to healing or justice. How we need to have a level of understanding and come together to recognize what those different roles mean for survivor and for the community as we work towards systemic and community change, right? So we each have that unique role. And if we keep thinking, oh, I work, in the prosecutor's office, and that means that I hold all this power and that, I can do whatever it may be, like we're not better than, we're not less than, and that we're really coming to things with equal standing, which is not to, that's a very like naive approach sometimes, because there are true power differentials that happen within spaces, and you're entering into communities sometimes where people don't want to let go of that power. People want to wield it in ways that's negative, and they might not even do it intentionally, but it's just the way that they've been doing it. And so you're coming up against even trying to think just simply as like all of our roles have equal value can be revolutionary in some communities. And it's not going to be easy. And so, offline, we could always be helping you walk through and talk through, some of those ways of like addressing or trying to kind of really push these things. But for right now, it's thinking about this fact, like, what would it be if we could come that way? What if we, when we sat around the table, we were truly thinking about like, okay, so from my different lens, and on here on the screen, there's the image of some clans. Many of our tribal communities have clans, and I introduce myself as, being part of the Eagle clan. And each of the clans within some communities have different roles that they play, right? Some people are the protectors, some people are the overseers, some people are those that are, like the first to go out, and some people are those that are, hold back a little bit more, all depending on what our different teachings are, right? And each of those clans is integral to every community, right? And this was an idea that was first brought forward to me by Bonnie Claremont, who works at the Tribal Law and Policy Institute, when I was doing more SART work. And it was this framework that really helped things click for me, that we need to do better with how we are approaching each other. And so, not saying that we all need to be thinking in this way, but I think that helps us recognize that even if we're coming from different frameworks, right? Like people are coming from a public safety lens. Some people are coming from, a survivor focus. Some people are coming from, I have this responsibility, to who I can say yes to, what I can prosecute to. That's beyond me, right? It's not them as individuals. It's who are we truly accountable to? And that can be our funders. That can be our statutes. That can be all of these different things that really help to shape our work. But if we're coming with the lens that we're all doing the best that we can with the information that we have, and that our role is equally important, and that their role is equally important, I think it could kind of start to create that change. And the more that we're able to truly be in connection and relationship with each other, and also having genuine conversation, because I think that there's so many misconceptions out there about every single every single part of a system or every single person who can come to the table, right? And sometimes if we can articulate some of these things or ask those questions, even things such as, I mean, I used to do a lot of advocacy training for brand new advocates. I was volunteer coordinator, and then I also just started to do these trainings. And so some folks may know that 40-hour advocacy trainings are like the thing that bring me the most joy, in part because it's that consciousness raising. It's sometimes for some people that first moment where, while they know that they're starting to do this work or starting to volunteer for kind of a reason, all of a sudden it'll open your eyes and help you understand the depth and the breadth of like what sexual violence really is and how endemic it is. And also often makes things in your own life or your own family or in your own friends start to click and start to understand a little bit more and a little bit deeper. But with those, I'd always bring in, some of, the local systems folks to kind of like talk about, because I can talk about law enforcement from my lens, but that's not the same as hearing about it, from law enforcement. And we also had this prosecutor, and it was interesting because every single time she would talk, it would just be like mind exploding kind of things for folks, because they would recognize that prosecution both has more power and less power, I think, sometimes than folks thought, and that it isn't so much about that individual prosecutor, but for our state, which is a PL 280 state, really thinking about, like, on behalf of the state, what is her responsibility, and how it's not the individual pressing charges, which is that misconception that we get out there, right? And so just in hearing her, step back and talk about who she was accountable to and what lens she was entering into when she was making her decisions, doesn't mean that every decision that this prosecutor made was right, or that that office did was agreeable per se, but it really helped people to understand, which can then help us be like, okay, so this is where you're coming from. This is where I'm coming from. These are those constraints that are making it a little bit difficult. But how, if we were operating under, truly using our Indigenous values and using these agreements that we have, could we minimize these assumptions and start to have genuine conversation and get to the root of issues, or think creatively? Because one thing about tribal communities, and sometimes like rural communities in particular, that's also one of my other things, is that rural communities have had to be super creative in the way that we have done things, because often, there is a lack of resources and all these sorts of things, but that doesn't mean that there's a lack of doing and joy and strength and all these sorts of things. And so you just have to think a little bit differently. And when you have to think differently, it is beautiful what can be created in those spaces. Anything to add about this, Ingrid?
I appreciate that a lot of what you mentioned on this slide comes back to what it means to be in good relationship with each other, both being a good relative and investing in and cultivating those good relationships, which part of a good relationship is mutual accountability, respect, and understanding. And I definitely spent quite a few years of my advocacy work with operating under a misconception about most of the other people on my multidisciplinary team. And when I started to really dig deep into those relationships with the individual, with the person, beyond their title, beyond their perceived power in the MDT space, I found just a deeper sense of collaboration and deeper trust. And in the end, who did it serve? It served our community. And so I just want to encourage folks listening to this, and even I just need to say it out loud for myself, that it always pays to invest in relationships. And it pays to identify where there's fear or where there's friction, where there's tension, because that's an opportunity for growth and an opportunity to think creatively and to shift our focus from ourselves and what makes us the most comfortable and feel the most safe and secure to what is best for our community and the survivors we're serving.
Thank you for that. And I know I keep thinking about how some of this is still theoretical for me. I just want to name this because I've seen a few, advocacy programs. I've seen a lot of like individuals, particularly people in leadership, who do really good at living out their values. They live with integrity, right? They say what they what they talk about is how they live their life, right? Which can't always be true. Like how often, and just even to call myself out sometimes, I will talk so much about practicing self-care and community care, and then at the same point just be utterly dragged out on some days, right? Which to an extent is a lack of integrity, because even though I know that this is well-meaning and this is what I want to be doing, it's one of those like do as I say, not as I do, which is not how we should be living. And I'm going to call myself out on that one. But what would it really be like if we were able to live out these values? And so, as I said, MIWSAC has our own kind of set of values, that we live by as an organization. And I think that all entities, be it your program, be it multidisciplinary teams, or even just if you're a group of people who are getting together who want to kind of create a little bit of change and to rock that boat, have some understanding. And maybe your community has some set values that you as a whole live by. These are some of the values of my community, the Anishinaabe. These are the 7 grandfathers teaching, and thinking about how life would be different if I live this out, and if we all live this out on a day-to-day basis, right? And so if we're thinking about, particularly within a response framework, what would it look like if we came to each other with love? And that is both that deep innate love that we have for each other, that connection that exists between us as humans, that kind of drumbeat, I guess, that like has that connection between us. If we really respected and came to people with love, what would that be like? But also with love, there's hardship, right? I'd say that most people who've loved anybody, be it our children, spouses, family, all that sort of stuff, it doesn't come easy. And sometimes with love, it comes, that little bit of difficulty. And often with those who you love, it's who you can speak the most truth with, right? It can be hard. And so what does that mean fully? Ingrid used talking about each other like as being in like relationship or being relatives, right? And that's one of the phrases that often gets talked about in our communities is, don't use clients, you say relatives and things like that, which can be a really good framework for people to be entering into. Like we're taking away like this power differential, we're taking away the difference between, clinician and client, or however it may be. That's a really good way. But also there's a level of responsibility that comes with saying that somebody's your relative, right? And what can that really mean? And how does that live out in a response, I think? And this is one of the things, that like I talk about, going through each of these, like with teams, thinking about, okay, so what does humility look like, especially in environments where there is a risk for litigation. Sometimes humility can be something that people are very aware of, because it's like, if we admit the faults that have happened within our system, does that set us up for community backlash, retaliation, lawsuits, right? This is the reality that can come with things sometimes. But should that hold us back from trying to live out these values the best that we can? And even certain things such as bravery, how it can be super, super scary to be speaking truth to power, or speaking truth to those who we have good relationship with sometimes, right? Where if we see something that is causing harm, how can we best enter into those spaces in ways? And so this is one of those things that I'm still hoping that I can get one of those pilot communities to start to live this out, or to find a community that's willing to be like, okay, like we've been doing our work for a long time and it's not working quite right. Yes, we have good relationships. Yes, we know who to call, and we have those like trappings of a good response, but it's not meeting the needs, because survivors are still saying that they aren't feeling listened to. Survivors are still not, reporting to anyone. People still aren't feeling heard. And when somebody retires, somebody quits, sometimes it's having to start this whole cycle all over again, right? But what could it look like? And so that is just my, I don't know, putting out into the world, that I would love to like find a community that wants to see how could we make this practical? How, when we're looking at every step of our protocols, for example, are we able to really look at it through this lens, both through the lens of perhaps these individual teachings for our community, but also thinking, okay, so like, what does it mean? Are the things that we have on paper, simply check boxes that we're supposed to have? Are there things that we've grabbed from this template over here, but we've never actually thought about, does this live out the way that we want to live out our work within our communities? And that's both for multidisciplinary teams as well as individual programs. Too often, the things that we say that we abide by were created by others and have never been really thought about through our own lens, and actually what is practical in our individual community with the nuances and the weirdness and the beauty and all of those sorts of things, right? All right, Ingrid, what are your thoughts on this?
Thank you for sharing about your teachings, and thank you for encouraging people to engage with traditional teachings and to really be honest about the ways that sometimes we're not able to bring them into the workplace. Not all of us are able to work in programs that are tribal. Not all of us are able to work with fellow tribal members or other Native folks. Sometimes we're kind of on our own. And so I appreciate you kind of issuing the call to action about how to live these out and the opportunities that await us all.
And this is my transparency again, and the fact that sometimes when I say Ingrid talk, it's because I need more coffee, because I like to drink coffee from like 8 a.m. until 10 p.m. and I just constantly need it. And so she knows that. And so we're thinking back on, like, what do survivors need? Because that has to be grounding everything that we do. So we both need to be living out our traditional values, because that is inherently what should be guiding us in each and every step. And I just want to be honest, also like what the traditional values are, of your community, my community, things like that. Sometimes those aren't always the things that like bubble up most for me. Like, for example, like I said, I think like when people ask me, like, what are my personal values? What are those things that I get drawn to most? There's some words that don't resonate with me. There's certain things where it's like, I get it, but like, that's not something that I say that I live by. And so those things that I live by, two of the things I value most are whimsy and curiosity, which is some nonsense for some people, right? Like, it doesn't make sense for others, but those are those things that if I enter into space, I have to be coming at it from that framework, as in addition to those other things that teach me and hold me to be, right? And also, what we need doesn't always matter. What do survivors need? And so here are just some of those things, that connection and a new way of being, and specifically cultural connection. And that may look different, right? And that may require some work, because there's so many of us who live so far from, our tribal lands or the communities that we identify as or identify with, right? Because it's sometimes regardless of where you are enrolled at or not enrolled at, that the teachings that you've been taught come at you from different ways, right? But also return to community, especially when I'm thinking about, for folks who have been, sex trafficked. And have sometimes, through the trafficking and maybe even before, have caused some harm within their spaces, right? Who have, there's been rifts with their family. It can be really hard, really humbling, and really sometimes embarrassing to kind of step into spaces where things have been bad. But how are we best able to, use our values to create ceremonies, to have programs or just ways of being that embraces people back into space, even if they have caused harm in the past, like in this sort of sense, like for people who are wanting to like reconnect to community and to be with us again. Survivors also need us to be thinking expansively. And this is not just saying, because for a lot of folks, the sexual assault is just one part of their life. It may be our sole focus. Like, my entire focus for my job is talking about sexual assault to communities across the country, right? That's not what people's lives are like most of the time. And so they need things such as, housing is one of those biggest issues. And so we need to be in relationship with other systems and also recognize the totality of people's lives. That, for some people, the biggest thing is childcare. It's just getting through the day sometimes. It's all these other sorts of things that our advocacy programs have not always been equipped to do, nor should one program be the be all end all for somebody, right? How we're having to work in relationship and recognize that even though something is a priority for us, say like you really wish that somebody would, report or move forward or whatever it may be, that may not be what's right for them at this point in time for so many different reasons. And how are we best creating alternative avenues and also making sure that folks feel welcome no matter what their choices are, right? And survivors, we just recently hosted a listening session with a bunch of advocates from across the country, and it was a really beautiful space. But there was something where there's both that idea of we need culturally designed and focused programs, and that's including how some of our tribal programs are not always culturally focused. You kind of like, yes, you have sage around, but you don't actually live out the stuff. But also that focus on prevention, how people are, even though prevention doesn't have sometimes those immediate results, that we need to always be thinking about how are we working to create that change so that things that people now think are, Indigenous values are actually just signs of trauma, right? And how we're needing to kind of really shift and really think beyond just those trappings of response, which is the next webinar that we'll be doing. And so, but this is kind of our last like little conversation before we kind of end is this isn't easy. And so, I think that some of the things I could, very explicitly name is I think that people need to be going through each and every paperwork that they have in their office and think about it through an Indigenous lens, right? And so, and some of those are just going to be, some of these aren't even papers, they're the practices that we do, the ways that we answer our phones sometimes. Are we thinking about the ways that we invite people in space? Are we thinking about the ways that we hire and recruit people to be part of our programs and therefore part of the overall response in community, right? And think about that through our Indigenous lens and thinking about like, are we really being respectful of, the trauma that people have experienced? Are some of our educational requirements that we have for certain positions actually creating arbitrary barriers? And my answer is yes, to be clear. I do think that some of our educational requirements create arbitrary barriers to allowing survivors and certain voices to be able to be at a table. What are we looking for? Are we looking for people who are the most polished within interviews or things like that? I could do a whole spiel on how I feel our hiring processes need to be looked at, but our internal policies, our practices, the ways that we share and when we talk to survivors, the ways that we talk to survivors about privacy and privilege and confidentiality, I think often are not fully lived out with our Indigenous values. And so taking that pause, and sometimes it's like, can we just take like a week, just one of those weeks where it happens to be a little slow and just do this deep dive? And that can be really hard if we are thinking about how sometimes our policies, they might have to go all the way through tribal council. And sometimes that can either be a slow process or that can be a process that they're just not receptive to your program and you want to like kind of lay a little bit low, right? And so this is sometimes idealistic, but what can you still do within your scope? And even though I've worked with so many communities here, they're like, things are not going to change until so-and-so dies, which is a very blunt and weird way to be living, but it's true in community after community. They're like, until this person dies or retires, nothing will change. Things have to. And so what can still be done? Maybe the entire system may not be able to be like revolutionized, but what can you still do to better incorporate our Indigenous values in the ways that you're interacting with people, interacting with survivors, and also through those few things that you may be able to change, right? Ingrid, what else is hard?
I think what we've talked about before is when you are not maybe in a tribal program, or maybe you are in like an urban-based Native serving program. Perhaps you're the one of a few Native folks in a non-Native program altogether. Sometimes it can feel easier to code switch, to move away from our traditional values in order to just go with the flow. Maybe we've been trained, whether explicitly or just because of the social norms within the workplace, to not speak up, and that our voice is not welcome, our true way of being is not welcomed, nonetheless, celebrated, valued, welcomed. And so in order to just do the work and to be able to be true to maybe our calling, or maybe just to keep a stable job, to keep the paycheck coming in. I'm not saying you have to, be in a job just because it's your true calling. We just go with the flow and we code switch, and we don't talk about certain things. We don't raise the question. And I think that those barriers, those institutional barriers, often make it hard to use our values, to live them out, to be all that we are across the board. I always think it's interesting when sometimes we don't recognize people outside of their professional role, maybe we don't physically recognize them because they're a different person than we expect them to be in the office. Maybe they're wearing their hair differently, they're wearing different clothes, they're with their family, and their family isn't what we imagined their family to be. And so we want to acknowledge that that does happen. That is a phenomenon, and we see that, and we value all of you, and we recognize and appreciate our past selves who have had to code switch, who've had to be a chameleon in a lot of ways in order to just do the work.
Thank you for that. And I think that there's so many more things that we had, wanted to dive into, including a lovely conversation about this idea about how are we best able to talk about like report writing is one of those areas where I think that we can be really doing a lot better. The way that we take our notes, both, as law enforcement, as advocates, things like that, the way that we document things can really show and live out both our understanding about, how the conceptualization of time, as well as living out our values. As a side note, I want to do that again in the future. So now we're already planting our seeds, as well as really thinking about how are we best talking about survivors and the way that we work and frame our connections with them. But this is our little dabbling about how can we best maybe start to embed some of our Indigenous values in our practical ways and just in our simple ways of existing, right? And this is also a lot of work for us to try to each day do a little bit better, right? And how can we be thinking broader when it's exhausting? Our lives are tired, and right now everyone seems to be incredibly tired. But by doing this, it'll make our work easier. It'll make our work more efficient, effective, and also ultimately just they'll feel better for communities as we start to really prevent violence and to help those who have experienced violence feel a little bit more uplifted and loved, right? And truly, truly believed. And so I have on here our contact information. The recording of this webinar will be sent out to folks. If you are needing to have any more specific sort of completion certificate, please reach out by email and we can get that to you. And we just want to continue to be in relationship. And so thank you so much, Ingrid, for being with us today. And thank you both, Angela and Hercules, for being part of our team today. The end.